Hi, my name is Dr. Ambridge from Santa Rosa Chiropractic Neurology Center. I want to speak with you today just a brief moment regarding leaky gut syndrome. I get many questions regarding this. I treat this frequently and it's a common problem in our society today. Let me just explain briefly what a leaky gut is. When you have an inflammatory response or exposure to your stomach over time, it doesn't take very long, it can be as short as 3 days, you can inflame the tissues enough to break down the fissures or the access lines in your gut for absorption. If those are affected, they become widened. Normally they're tiny. Only nutrients and molecules can absorb through that little fissure. When it becomes enlarged and gaping, you get macromolecules or particles of food that then get into the bloodstream, which is not where they are supposed to be. So your gut is designed to break down your foods into subunits that they can absorb as nutrients. If something other than that gets into the bloodstream, then you have an immune reaction. Chronic exposure to that creates a whole pro-inflammatory condition in a body, which can cause a number of problems. That essentially is a leaky gut. When that syndrome occurs, you suffer a number of conditions or symptoms between bloating, gas, upset stomach, acid reflux, gastritis. There's a whole series of things that can happen. There really isn't, never seen a case of gastritis or ulcerative colitis or any of those where there wasn't a leaky gut. And this is part of why a gut breaks down. You've got to repair that gut so you don't have full body inflammation affecting the tissues involved there, whether that's brain, muscle, joint. You also have to repair that so you don't have autoimmune conditions, whether that's lupus, etc., etc. So in the repair of that, there are two goals. One is to remove the foods or the items that are provoking the inflammatory response, and two, heal it up. You cannot heal it up until you have identified those foods. Identifying those foods becomes a bit of a challenge. I personally prefer to do testing because it's far more specific and certain as to what your body's responding to. And then there's a protocol that you go through, which is basically helping with the digestive enzymes and probiotics. You use D3 and you use some herbs and some things to heal up your gut, as long as you're avoiding the offending foods, whatever those may be. In a leaky gut, you could get responsive or reactive immunologically with any food, the most innocent food, kale, spinach, anything, can then become reactive to your body. So food allergy testing, while you have a leaky gut, is quite unpredictable and risky because you can get many false negatives or positives, mostly positives, and you don't really know if you're going to have a problem with those foods indefinitely. So I recommend that you ascertain which foods they are. You can do an elimination diet. That's a long process. I prefer actually doing blood tests that are certain so that we clear about moving forward. We save a lot of time. So I hope that's been helpful for you today and that you can move forward in great health.